Okay, good morning, good afternoon, good evening, everyone. Thank you very much for joining us for our webinar titled Promoting Healthy Couples Communication to Reproductive Health. My name is Maria Carrasco, and I will be moderating today's webinar. I am a behavioral scientist. Slide, please. I'm a behavioral scientist, and I currently work as a senior implementation sciences technical advisor for the Office of Population and Reproductive Health at USAID. In this role, I coordinate work on the high impact practices in family planning, or HIPS, and I work closely with the HIP Technical Advisory Group, our HIP TAG, to develop guidance for the three new SBC HIP briefs. Today's webinar focuses on one of those briefs. Next slide, please. I'm not seeing them passing, so let's go to the next slide. Okay, excellent. In terms of today's agenda, I will be giving a brief summary of what the HIPs are and also a short summary of the new SBC overview brief. My colleagues Robert Ainsley and Isete Geitacho will present a summary of the couples communication HIP brief and also an example from implementation experience of couples communication in SBC programs. We will leave approximately 25 minutes for questions, so please have those ready. Next slide, please. Now let's go quickly through some logistical information. Please note that this webinar will be recorded and posted on the HIPS website. If you find that this webinar is helpful, please share it with colleagues so that they also have access to the information shared today. To download the handouts for the webinar, you can go to the command panel on this platform and click on the handout section, and you'll find all of them there. And finally, to ask your questions, please write your questions in the questions section of the command panel that appears in your screen. Slide, please. Okay, now let's begin the technical content of today. So to begin with, let's remind ourselves what are the high impact practices in family planning, or HIPs. The HIPs which are encapsulated in our HIP briefs, are an effort to summarize the evidence and establish consensus on what works in family planning. The HIPs are family planning practices that are vetted by experts against specific criteria. And the criteria you can find on our website, and it is replicability, scalability, sustainability, cost effectiveness, and evidence of impact in achieving various family planning outcomes. An important characteristic of the HIP briefs is that they are short and they are written using clear language. In fact, we really try to avoid using any jargon. Next slide, please. There are four categories of HIP briefs, and you see that those in the slide: in the enabling environment, service delivery, social and behavior change, or SBC, and enhancements. The couples communication brief that we are discussing today is one of 6 social and behavior change briefs. SBC, or social and behavior change, is an evidence-driven approach to improve and sustain changes in behaviors, leading to improved health outcomes. And SBC programs employ an understanding of a variety of fields, including social psychology, communication, anthropology, behavioral economics, sociology, human-centered design, and social marketing. In recent years, SBC programming for improved health has gained more and more prominence. And this, for behavioral scientists like me, has been very exciting to see. For example, very recently, the WHO issued a resolution supporting the use of behavioral sciences for better health. So these 3 new briefs, SBC new briefs, are very timely in supporting the implementation of evidence-based SBC programs. For those of you who are new to SBC, and also for those of you who have many, many years of experience with SBC, we hope that today's webinar helps you to understand the importance of addressing couples communication in family planning programs, and also that the presentations today give you new ideas on how to do it. Next slide, please. As noted earlier, the HIP brief summarizes the high impact practice. In the briefs, you will find a summary of the evidence of the impact and also tips on implementation of the practice. And you can find all of our briefs on the HIP's website. Next slide, please. And as mentioned earlier, one important thing I'll be sharing with you is a brief summary of our social and behavior change overview brief. In this brief, the authors provided an integrated framework of how the 6 social and behavior change briefs can be used and how they relate to each other. And you can see the framework in this slide. On the right-hand side of the slide, you see what I'm going to call the old or the existing SBC briefs, the 3 old SBC briefs, and those are mass media, a brief on mass media, community group engagement, and digital health. These 3 briefs are very useful in highlighting channels of communication that have proven to help to reach family planning outcomes. However, the HIP Technical Advisory Group noted that some of our audience of the HIP readers may think that any of these channels on their own could work to reach family planning outcomes. And while in some cases a channel in isolation could work, so used by itself, a mass media program can help you reach your family planning outcomes. It is actually more common to see in practice that several of the channels are used to reach family planning objectives. In fact, one of the examples that will be later shared in this webinar shows a program that used several channels to implement a couples communication activity. So as an answer to these, the 3 new SBC briefs take this into account and they summarize the evidence pointing to key behavioral determinants or behavioral factors that were identified in the literature as critical to reach family planning outcomes. The new SBC briefs also provide a summary of the channels of communication that work to address those critical behavioral determinants. On the left side of the graphic, you see the behavioral determinants that are the focus of the 3 new briefs in the concentric circles. And each of those circles are part of what some of you may recognize as the ecological model. So the 3 new briefs address a determinant at the individual level, interpersonal level, community level. And today, again, we will be discussing the couples communication brief, which operates at the interpersonal level. Next slide, please. With this short summary, let's just move to hear more about the couples communication brief. But before we do that, I will be remiss not to mention the authors of the briefs who worked over several months to put together the brief in 8 pages. I know 8 pages seems short, but it takes a lot of work to summarize a whole lot of literature and present it in very clear terms. So we will get started first with our colleague Robert Ainsley, and then we'll go on to hear from Esete Getachew. So let me introduce Rob first and then pass the floor on to him. So Rob has over 30 years of experience working in social and behavior change programs, and he currently works for the Johns Hopkins Center for Communication Programs. He has managed social and behavior change programs in numerous countries, including Indonesia, Mozambique, Haiti, just to name a few. And he has focused on different health topics, including family planning and reproductive health, of course, and malaria, maternal child health, among several others. And I have to say, I have the privilege of working with Rob a little bit on this brief that will be presented today. And he is a joy to work with, very collaborative, patient, and focused. And he served as the team lead for the team that wrote the brief. And with that, I pass it on to Rob, who will share a summary of the couples communication brief. Over to you, Rob.
Hi, thank you, Maria, for the introduction. Good morning, good afternoon, and good evening. Next slide, please. I'm happy to be here to introduce the Healthy Couples Communication brief. And I'm one of many on a team that helped write this brief. We had 6 or 7 authors and 1 writer that helped us put it all together. So I'm just one part of that. We define couples communication as a form of interpersonal communication that entails the exchange or sharing of information, thoughts, ideas, intentions, and feelings between sexual partners. The high impact practice that we're promoting is promoting interventions demonstrated to encourage couples to discuss family planning and reproductive health and make equitable joint decisions to reach fertility intentions. While there are many forms of interpersonal communication that can lead to uptake of modern contraceptives or improved reproductive health outcomes, including interpersonal communication between woman and woman, man to man, parent to child, but for this brief, we are focused on interpersonal communication between couples and sexual partners. We have seen since the 1990s the importance of couples communication and what it can do for improving reproductive health outcomes. In the last decade, we have seen evidence on the importance of couples communication with a focus on improving these discussions and addressing gender inequalities. However, as important and effective that couples communication can be, it is important to remember that access to modern contraceptive methods and reproductive autonomy are fundamental human rights, and individuals must be able to access contraception as an individual right. Involvement of the male partner should not prevent women from choosing contraception free from the influence of a male partner. Next slide, please. So in the brief, we have different sections as Maria was explaining, and one of those is why is the practice, after the summary, why is the practice important? Well, there's a number of reasons we focused on in the brief. All couples can benefit from improving their communication. Studies show that many times agreement among spouses on waiting time for next birth was inconsistent. In one intervention, couples counseling on contraception helped male partners realize that spacing is directly related to the overall health and financial security in their family, as well as leading to overall improvements in a marital relationship. Improved couples communication can increase uptake of modern contraception and help couples achieve their fertility intentions. In India, the CHARM initiative used family planning and gender equality counseling sessions for men and women to improve interpersonal communication among the couples and discussion around family planning and reproductive health. And the evaluation showed significant increases in contraceptive communication, increased use of modern contraceptives, as well as women reporting less intimate partner violence than in the control group. A study in Niger found that while 75% of young couples did not report discussion related to contraceptive use, however, those that did discuss contraceptive use were more likely to report contraceptive use overtly. As well as promoting healthy couples communication can also impact gender equality, in addition to improved contraceptive outcomes. In one study in Rwanda for male involvement in reproductive and maternal health and transforming gender norms, women reported that men in the intervention group had higher levels of participation in childcare than men in the control group, as well as improved contraceptive outcomes for the group. Next slide, please. So in the brief, we talk about what the evidence there is of promoting couples communication and why it's high impact. In the brief, we include selected findings with evidence of the impact of couples communication on uptake of modern contraceptives. We include the table as seen here with information on the intervention, where the intervention was implemented, and then the impact on couple communication, modern contraceptive uptake, and also if there was impact on gender-based violence and gender equality in the intervention. And this is in the main part of the brief, as well as we have an addendum with more examples. Next slide, please. So how do we do it? What types of SBC interventions were used when we're doing these interventions? And studies show that a number of the efforts, SBC efforts to improve couples communication has resulted in uptake of modern contraceptives through sessions, counseling sessions with couples, reaching men through trained peer educators, participatory small group discussions, mass media, including soap operas, Inter-Educate TV series, TV ads, serial radio dramas, and trained staff. So there's a number of ways and different interventions you can use in modeling and introducing couple communication, from mass media to interpersonal communication, counseling sessions, etc. Next slide. Also in the brief, we provide tips for implementation for the interventions. We include a number of tips for the brief, including a couple of these that we found important. One is it's important to address gender and power dynamics, including gender-based violence. It is crucial to understand the context where you are implementing before developing the appropriate interventions, so you take into consideration what's happening in the area, in the context around communication, couple communication, and interpersonal communication. Ensure that interventions do no harm to undermine women's autonomy. We have an example included in the brief where the intervention that we focused on increased male involvement in family planning and couples counseling. It worked well, and the evaluation found that respondents were 1.6 times more likely to use modern family planning methods if they were exposed to at least 3 components of the media campaign. Both men and women reported increased discussion with spouses about family planning. However, the campaign, while increasing couples' communication, resulting in uptake of modern contraception, also resulted in a significant increase in men believing that they alone should take responsibility for choosing a method, getting family planning information, and going to a clinic to seek family planning services, reducing women's autonomy and increasing gender inequality. A key lesson learned was that attention to gender and power dynamics is critical. Also, find creative and culturally appropriate ways to address women's and men's skills and perceived self-efficacy to communicate to their partner with their partners effectively. People need to practice how to do it before they start to communicate with their partner. Ensure those spaces are there and the time is there's time to do that. Identify and provide opportunities for respected couples in the community to model and talk about their healthy communication habits. We need to find ways to model the behaviors, whether through media, mass media, or through those implementing the programs or others in the community. So people that are learning and improving their interpersonal communication can learn from others and model those behaviors. Next slide. And there's other implementation tips. So were just a couple of the ones we wanted to highlight. In the brief, we also talk about indicators that can be used to measure the outcomes of couple communication, and we identify a number of those indicators, as well as identifying some priority research questions to answer. So a couple of those include: do digital platforms successfully increase healthy couples communication? So we know there's a number, and people are using digital more and more these days, but we need to see what the evidence is and how that works, and also how we can use digital to improve our programming. What programs and policies prepare adolescents to engage on couples communication? How do we start earlier with adolescents to start that part of the communication going that actually will build on their strengths and abilities and help in their long-lasting relationships and their relationships on after adolescence? Also, what are the steps required to minimize potential negative impacts on couple communication, such as violence and reproductive coercion? How are we ensuring that agency is there and that healthy communication is looking at equality and ensuring there's a power balance in the communication? So those are a number of parts that are included in the brief that we wanted to bring out. And if you see in the brief, there's references, there are tools, as well as the table of the impact of the evidence. Thank you very much, and I'm going to turn it back to Maria.
Thank you very much, Rob, for that great presentation. And just to remind everyone, you can find the brief on the HIPS website. And again, it's 8 brief pages, but they're full of excellent and very helpful information. Okay, now on to our next part of the webinar. It is my pleasure to introduce Ezete Getachew. She has 12 years of experience implementing social and behavior change programs, and she currently serves as the Gender Equality and Social Inclusion Deputy Lead for the Breakthrough Action Program implemented by the Johns Hopkins Center for Communication Programs. Esete has experience in developing, or expertise actually, over many, many years of developing SBC materials, designing and implementing mass media and community level interventions, and addressing gender norms. And today she'll be sharing with us an example from implementation. So I just remind everyone to please note your questions in the chat as they come in. Feel free to go ahead and write them down, and we will, after Isete's presentation, we'll go on to the Q&A portion of today's webinar. So with that introduction, I turn it over to Isete. Isete, over to you.
Thank you, Maria, for the introduction. Good afternoon, good evening, or good morning, depending on where you're joining from. I am pleased to be here with you today to share the experience from Communication for Health project, which was implemented in Ethiopia, and talk about how couple communication was integrated into the different project activities. Next slide, please. So just to start off with giving you a little bit of background about the project, Communication for Health was a 5-year project funded by USAID. It's an integrated SBC project designed to increase knowledge and practices of individuals and communities across multiple health areas, including reproductive, maternal and newborn child health, PMCT, nutrition, malaria, TB, and WASH. The project was implemented in 4 major regions of the country, and later on expanded to additional regions to Gambela and Benishangul under the Breakthrough Action Project. But my focus for this presentation is on the work that is done in these 4 regions within the Communication for Health implementing years. Some of the strategic approaches to carry out the project were using the socio-ecological model and the life cycle approach to reach our intended audiences with all the information and the skills that are relevant to their different life stages. Next slide, please. So since the project covered multiple areas, especially during the first years of the project, it was necessary to identify cross-cutting approaches that address these different health behaviors. So as you can see from the slide here, the project baseline survey which was conducted in 2016, showed us that gender equitable norms were significantly associated with 10 out of the 16 health behaviors which the project was aiming at influencing or changing across the different health areas. Gender norms and practices was identified. So with this finding, we were able to see that gender norms and practices as one of the main barrier that cuts across different recommended health practices, including use of family planning and other maternal and child health services, such as early registration for ANC, institutional delivery, and other health behaviors outside of the reproductive and maternal health issues as well, such as malaria-related health behaviors, use of L-line, and early treatment seeking at the onset of fever. Next slide, please. So the GEM scale, or the Gender Equitable Men Scale, was adopted for women and used to measure gender-related attitudes within our intended audiences, and specifically to measure attitudes around gender norms within households, specifically among women. And the scale has around 21 items organized within the 4 subscales, as you can see here, to measure gender norms in different domains within the construct of gender. So as you can see from the slide here, domestic chores and daily life focuses on attitudes around who does what in the household, what are the roles and responsibilities of men and women, and looking at who makes decision, in what roles are male engaged, or to what level couple communicate on what kind of issues. Partner violence described the power relation within the family, and then sexual relationships looked at norms around sexual rights, and reproductive health and disease prevention looked into women's role on timing and number of children. Next slide, please. So overall, respondents showing greater support or higher support for equitable gender norms were significantly more likely to practice recommended health behaviors. And from these different subscales that I just showed you in the previous slide, the domestic chores and the daily life subscale, which focused on women's role in decision making and also looked at engagement and couple communication, was associated with 4 behaviors, including the use of modern contraceptives, going for early ANC, opting for HIV testing, and use of long-lasting insecticide-treated bed nets. So as a cross-cutting issue, we were able to see that promoting couple communication and male engagement in family life have the potential to influence multiple health behaviors. And this was also supported by the literature review, which indicated that many women in the regions that we were working in, are often unable to adopt some of the recommended health behaviors without their husband's consent and participation, and yet husbands are not well informed or nor positively predisposed to adopt to the recommended practices. Next slide, please. So these findings kind of guided the project to prioritize integration of gender into its activities. So issues around couple communication, sharing of decisions in the household, male engagement in household work, childcare, and overall family health, and really creating respect or nurturing respect for women's value and contribution in the community were prioritized and intentionally included in our core messaging and overall design and implementation of the project activities, be it a mass media within the social mobilization activities or capacity strengthening activities. But however, for this presentation, I will be only focusing on these 3 main activities of the project for today, to talk about how the project used a weekly radio program called ERCUP to model healthy relationships and couple communication, and how a mobile application was also used to enhance partner engagement in reproductive, maternal and newborn child health, and a job aid that was developed for health extension workers to support couple communication and couple discussion during house-to-house visits. Next slide. So the first up is the weekly radio program. The radio program was designed to empower communities through stories. So although the main objective of the program was to address health behaviors, it was also intentional in trying to change the narratives of women, promoting couple communication and male engagement, and challenging any gender norms and social rules that were evidently limiting to women or men. We tried to integrate these thoughts into this radio program in every opportunity. The radio program was a 30-minute entertaining program that combined fictional and real-life stories. It contained 2 storylines. The drama addresses several issues through a story of a couple as they go through life, and demonstrate how community comes together to solve a problem. So these storylines were co-created with the intended audiences and adapted to be relevant to the different regions that we were implementing in. So just to give you some little bit of detail about the radio program, Nuz'u was the main character who's a 19-year-old girl pressured into early marriage by her dying father, with a high school friend who's desperate for her love and attention, but then she's living with a jealous husband who turns to be violent, and again with a community piece in the storyline coming together for a common good or to address a common solution identified to address a problem identified in their community. So the fictional story, which revolves around Nuswu and her husband and her other supporting characters, is also supplemented by reality segment that tells real stories of individuals, stories of couples to show the benefits of, the desired action, the benefits of having communication openly and sharing decision making, and the benefits of a partner engaging in household chores and childcare related responsibilities in the household. So through the story of the main character and other main women characters, we intended to change the narratives of women by showing their agency, like actively making decisions for everyday life, including, when to have a child, or it could be related with progressing with their own aspiration and with achieving or improving their education, regardless of the challenge they may face, as most young women are married off at young age. Nuswu and Tasfa were not the ideal couples as well. They were not communicating well, they were not sharing responsibilities in the household, and also kind of through the stories we were able to show some of the consequences they have faced, both health related, economy, or other social economic related consequences they may have faced due to that. So we received a lot of feedback and interest from our listeners about relationships. People really wanted to know. Through our feedback mechanism, we learned that people are so interested to learn more about relationships. So we also created a radio personality who was included in the segment to answer questions that come directly from our listeners about relationships. And this radio personality is not a health service provider, but someone that comes from the community, so that we keep this radio personality very relevant to our intended audience. And through her responses, we also tried to promote small, doable, and practical cultural appropriate actions to nurture public communication and shared decision making in the household. Next slide, please. So the next slide, the next activity I want to talk about is the Hullu Bad'ina, All is Possible Through Health mobile application, which is a client-based mobile app developed for rural families to access different life-saving health messages related to family planning, maternal and newborn child health. Studies indicate that men have greater access to media and technologies, including mobile phones, but have not been really prioritized for health information, particularly when it comes to reproductive, maternal, and newborn child health issues, as the issue is often considered as a women's issue. So men often lack the knowledge and the information they need to make the joint and informed decision with their partners, and at times even support with advising their partner on health practices or encouraging her to use health services appropriately. So leveraging men's existing access to mobile phone, the app was designed in a way that speaks to both men and women in terms of language use and messaging. It also has, the app has, like specific tips for husbands and for partners on what they need to know and do to be a supportive partner at different life stages, starting from pre-pregnancy through pregnancy, delivery, and as parents of under 2 children. The overall feedback we got on the app was positive, with a lot of interest to have the application as on their phone as something new, and considering it as a reliable source of information that is accessible at any time and place. The next slide, please. The next one is a job aid, which was designed and developed for health extension workers. Something that this job aid is intended to be used by health extension workers during house-to-house visits. And this tool was actually more implemented during the extension of Communication for Health project. And like the reason behind we developed this tool was that oftentimes men are either not at home during house-to-house visits, or they walk away of the house, they walk out of the house as health extensions workers walk in, especially if the discussion is about anything about family planning or reproductive health. As like I said earlier, since this issue is considered as a women's issue, in most of the times men are not part of the discussion. So the main aim of the tool, or this cue card, is to guide or to help health extension workers to engage husbands in household discussions, and to help them talk about issues that are traditionally considered as a women's issue, such as childcare and family planning news. So the cue card has discussion questions that health extension workers can pose to couples, and based on once they have their discussions, it also have summarizing key messages which health extension workers can easily refer to when engaging or
It sounds like we lost Sete. Sete, are you still there?
Next slide. Okay. So 3 years later, after our baseline study and after the implementation of these activities, especially the radio program and the mobile application, a midterm evaluation was conducted, and interestingly indicated a significant improvement on gender equitable norms. From, as you can see from the chart on your right, from 17% to 37%. And the domestic chores and daily life subscale, which we found was most influential to multiple health behaviors, has also shown an increase from 21% to 34%. Next slide, please. So the midterm finding also indicated that this shifts in attitudes around gender norms have also resulted in significant gains on RMNCH related health behaviors, such as 4+ ANC, family planning news, institutional delivery, PNC, PMCT, and having a household hand washing facility. With that, all these intervention and the finding from our midline also has made our gender integration work, and our couple communication focus worthwhile, and something that we should continue doing in order to improve health outcomes as well. And thank you.
Excellent. Thank you very much, Esete, and thank you very much, Rob, for great presentations. So now let's move to the question and answer portion of our webinar. I want to remind everyone to please go ahead and write your questions in the question and answer section of this platform. So let's start with a question for Rob. Rob, can you, from all the possible channels, and this is a question for me, while we wait for more questions from the audience, but from all the possible channels to use to address couples communication, one question is, how can listeners know which channel will work better in our context? As we heard it said, several channels were used in the example she shared. For others implementing programs out there, which channel should they choose? Thank you.
Yeah, thank you, Maria. It's kind of it's important to understand what people are engaged in their communities. And so one of the things developing the programs, what are those channels that are used at the community level, whether you're looking at mass media or interpersonal communication, counseling, et cetera. But it's also dependent on the program itself. So what are the objectives of the program, and what are you trying to do around gender norms, social norms, improving that communication? The more we have something called dose effect. So the more channels that you're engaging people in, the better chance that behavior is going to be changed. So if you have just one way to do it, which is fine, but if people are seeing that behavior being modeled or seeing that behavior in other areas besides just in a counseling, they might see it in print materials, they might hear it on the radio, they might see it on TV, they might get messages on the digital. So the more channels you use, the better chances that you're going to change that behavior. However, more channels is also a function of what your budget is and how big the program is. So it really depends. There's not one channel that works better than others. Looking at, when you're changing community norms, you're looking at how do you look at stakeholders and community leaders that help set that agenda. How do you reach those groups, as well as the individuals in that specific behavior change around couples communication? So there's not a hard and dry answer to say, oh, you should always use radio, you should always use counseling, you should always use small group discussions. It really depends on what the objectives are, how much your budget is to implement these programs, and what resources do you have available, including human resources available at the community level, at the facility level, etc.
Great. Thank you very much, Rob. Now let's go to some questions from the audience, and excuse me if I look to my other screen, but that's where I have the question. So there are a couple of questions that have come in from a colleague, Radhika Jimire, and they are around monitoring and evaluation. So one question is about whether there is a quick approach to find out the number of audience or listeners of radio and TV programs other than surveys, because surveys take a lot of time, and this, I'm going to add, they can also be very expensive. And then related to that, again, on the monitoring and evaluation topic, Radik is also asking, how can we monitor the audience of radio and TV communication channels when we use those channels? Is there a preferred way to do it, again, other than surveys that you have used? Thank you. And this can go to Rob and Esete. Thank you.
Okay, just to reflect on that, I think from the experience from Ethiopia, one of the approaches that we used was having a reach and recall research or data collection to really, keep track of how much of the messages that we're sending out are being recalled by our listeners, and which ones were, and how much of the messages are reaching the target audience. And based on our findings, we were able to change some, make changes to ensure that which ones are much of an interest to our listeners. But at the same time, if we're not getting the type of reach or the amount of reach that we have originally anticipated, we've used in different promotional and other outlets to ensure that the produced contents and the radio programs are reaching the target audiences. So, like for monitoring the reach and recall, we're mainly one of the main approaches that we used. But then the listeners' feedback was also very important for our programming. We had a free call, free online, free number where we collect feedbacks from our listeners. They can call in at the end of each program and put in their feedback as well, which we then, analyze and make the necessary changes accordingly.
Excellent.
And I would just add
Go ahead, Rob.
quickly that there are, in a lot of using mass media, a lot of the radio and TV stations have a lot of social media channels now, and so there's a lot of ways to get feedback from the audience around on those social media channels, on the feedback kind of instant with the programs, and sending out questions through that.
Okay.
Again, cheaper than surveys. And there's qualitative too, that you can get information, but it's not going to give you numbers of listeners.
Excellent. Thank you very much for that. That was very helpful, and I hope that helped our webinar participant. Thank you for the questions. Please keep them coming. I'm going to go to another question from our webinar participants. It is from Daniela Azar, and she says, hello there. I'm a sexual and reproductive health officer in Care Deutschland Libya office, and my question is for ESETE. I'm interested to know the challenges they have faced when implementing job aids for health extension workers, especially when used for house-to-house visits. Over to you, ESETE.
Well, that's a good question. Yeah. So one of the challenge and something that we've also anticipated is that health extension workers or health providers have also their own understanding or their own bias when it comes to gender and when it comes to couple communication as well. So we could not assume that health extension workers would push for couple communication, even if we provided the guide. It was also important somehow to give them the proper orientation and to go through a proper value clarification exercise with them, so that they'll are also able to understand and able to really see the importance of engaging couples during house-to-house visits. So just availing the tool may not be enough. It has to go along and with the appropriate type of orientation or awareness creation with the health extension workers as well. I think that was one challenge that we anticipated that we would face. That would be a challenge for really implementing and there would also again be some setbacks. Still, there might be, whenever they visit households, some challenge they've also communicated with us was that even when they go to households, still men, they're having a problem really setting the discussion with male partners still. But again, once they've understand the linkages, I think was the most important point for us to encourage them to keep pushing during house-to-house visits.
Excellent. Thank you very much for that, ESETE. Let's go to another question. This is from a colleague, Rudra Pradhan, and he is noting that we work in low and middle income countries in areas that are media dark, where there may not be a lot of different channels of communication to use. So in these environments, what are the preferred channels of communication or ways to work to address couples communication that you can share, Rob, and also ESETE? So let's start with Rob on this one.
Yeah, thanks for the question. There are a number in the brief. There are a number of examples of programs that are doing small group counseling, or programs where you're doing mixed couple counseling sessions, or activities as well as single sex, where you're talking about different topics as well as similar topics and then bring them together. So there's a number of ways that you can do this through non-mass media. So if you're using just on the ground community mobilization efforts, or single house-to-house visits. In Guatemala, we're doing a program called Padres Presentes, which are present fathers that are grouping young fathers together and going through challenging gender norms, trying to get more involvement in childcare. We're looking at nutrition, spacing, family planning, reproductive health. But we're doing that in groups with the young fathers. We also have a program that works with young mothers, and so we're able to have different topics talking to each other, and then when they come together to ensure that communication's happening, and that they have cues, that they have ways to initiate conversations around child care, child raising, child nutrition, etc. So there are a number of ways that you can do these programs without mass media. And there are a number of examples in the brief.
Good. Just to add on that, like from the experience of our project, for media dark areas, we tried, although it was not that much successful, but like using the content from the radio and taking it to the community, and kind of organizing a listeners group where they listen to the story and continue with a discussion based on the discussion guide that goes with the radio program. So we tried that to some level, but we were not able to reach many listeners through that, because it was the work. Having listeners group discussion had its own challenge in our context in terms of resource and really deciding on who's leading the discussion in a long term. Yeah, so that was one approach that we try to use to reach media dark areas.
Excellent. Thank you very much, Rob and Isete. Let's move on to our next question. So this next question is about communication channel. It's from colleague Wisal Ahmed, and he is saying that communication channels used in the example shared by Isete were very diverse. There were several channels used. However, in real world settings, budgets are constrained. So, you may not be able to use as many channels. What are the essential communication interventions that could be used that have a sustainability potential with existing governmental services, again, taking into account constrained budgets and how to reach project objectives and reach couples communication successfully? Thank you. And this one is for Isete.
Thank you for that great question. Yes. So, I mean, personally, I would say that, like having something integrated with an existing system. I think the health extension workers and the health extension system in our country, or it could be in other countries as well, is a very powerful mechanism to reach households. And something, like enhancing health extension workers' capacity and really providing job aids that supports their work regarding couple communication and other SPC work would be very impactful, because it's something that's already existing and something that could be reinforced. Because radio production and other media interventions, like you said, can be very can be demanding in terms of resource. So maybe if resource does not allow, I think identifying existing systems within the structure, within the health system structure, and really capacitating or enabling health extension workers to be more cognizant to couple communication in their everyday work.
Great. Thank you very much, Isete. Okay, there are some great questions, and if we don't get to your question, apologies in advance. There are some great questions coming through. We will try to answer them after the webinar. But let's go to this question from Anne Fiedler. She says, too many African radio and TV dramas have characters of violent husbands to drive through the message for change, for behavior change. Can the scripts be changed? Would we get similar results if this is done? And must men always be portrayed in the negative? And we know that positive deviants do exist. And I think this one, we can go first to Rob and then to Sete, since you both have excellent and a long implementation experience. Thanks.
Yeah, thank you for the great question. You're right. There's a number of approaches when you're looking at intereducate programming, whether that's radio, TV, etc., on who are those protagonists and what needs to happen. Do you have the traditional way of looking, and it has been said as having you have the protagonist that is the bad person and usually ends up with those choices not help working out for that person. You also need to have those positive deviants, as you say, in there. You have to show and model those behaviors, that there are other ways of doing it, like the good guy, the person that's participating, and how that person gets ahead. So you do really want to show, you want to model those behaviors that are good behaviors, while not overpowering the bad behavior, because you don't want people coming off like, oh, that's a good one to model. You want to model the good behavior, and show that there are different ways to follow that behavior. Usually we're looking at in developing these arcs and these archetypes of people that someone that is kind of on the fence, sitting on it and seeing where they're going to go one way or the other. They could lean one or go the other, and they take the right route, and good things happen. And that helps people identify, because not everybody is in the same place in their life, looking at these different characters. So you have to be able to give them identifiable characters they can look at and learn from, so they could also model that behavior. But yeah, truly you do need those good characters, but those bad characters, shows what's the result of that negative behavior. Thank you.
Yeah, just to add that, sorry.
Go ahead, Sete, please, go ahead.
No, I just wanted to add, yes, I agree that we also need to have positive deviants as well. And we also had characters and stories of couples who were practicing all the positive behaviors, but sometimes we also wanted to make the story relevant, because the stories of these positive deviants may be far from the community or from the stories of the community. So just within that balance, we try to incorporate both stories that shows the reality, but at the same time stories of positive men or positive couples that would also serve as a good source of information. Thank you.
Okay, excellent. Thank you so much, Sete. And then one final question that, if you could be brief, Sete. It comes from two of the webinar participants, and is related to the slide where you had the bar graphs. And the question is, how can you explain the difference? This is from Rodolfo Gomez, Ponce de Leon, and Sita Shankar. And how can you explain the difference between exposed to non-exposed to the intervention on couples communication? And again, I believe it's slide 9 on your presentation, Sete.
Yes, so we looked at, kind of collecting data from our responders who were exposed to at least one of our intervention materials, and who were not exposed to none of our SBC tools or SBC activities. Based on, it could be whether either they may have recalled it, but just to see how much it's comparing respondents who were exposed to at least one of our SBC materials or activities, and comparing those who were not to exposed to none of our materials, or who did not recall any of the branding or any of the programs that we were implementing. So the comparison between the exposed and unexposed is based off that. I don't know if I answered the questions, but we have the online reports included in the chat, which I believe we've also shared about the project. So you can have the full report from there to learn more about how these the exposed and unexposed were measured.
Excellent. Thank you so much, Ezete, and thank you, everyone. We are at time. So before we close, I just want to share with everyone the hyperlink with to the presentation and the recording. Next slide, please. And for more information on the new SBC briefs and to get a copy of the brief presented today, please go to the HIP website, which you can see in this slide. Thanks again to the panelists for excellent presentations, Ezete and Rob, and also to our colleague Ados May, who's been handling all of the logistics in the background, and the IBP network who organized the webinar today. Also, thank you all for your participation, and have a wonderful rest of your days. Goodbye. Thanks.
Thank you.
Thank you.